And here with answers to your medical questions in our Ask the Doc segment is Dr. Mysonte Levine. So blood pressure medicine also helping with the brain.
Yeah, I mean, we've really always known that. I mean, that's really the big thing in America, cardiovascular disease. Cancer now #1 killer in America, but cardiovascular disease is a close second. It used to be cardiovascular disease, and the risk factors are high blood pressure, diabetes, and high cholesterol. So it makes sense to me that you want to control your blood pressure, because if not, then it causes damage to the blood vessels over time. You need oxygen for your brain. If your blood vessels cannot deliver the oxygen, then you get degeneration of the brain and can lead to things like dementia. So it all makes sense to me, which is why we recommend patients to check their blood pressures regularly. It is the silent killer. Just because you feel okay does not mean that the blood pressure is controlled. So we want you to check it regularly and get to your doctor if you see it high. Unfortunately, some patients still monitor their blood pressure at home. They see that it's high. They don't make any phone calls. That is actually the wrong thing to do. That's why we ask you to monitor it. We have so many good medications on the market, generic, name brand, once a day, twice a day. The bottom line is to control those risk factors. You're less likely to progress to things like Alzheimer's, dementia.
Now, when you ask patients to monitor their blood pressure at home, how often should they take their blood pressure at home? Because you don't want them to do it every hour on the hour, correct?
Well, you can, but it's a little cumbersome. I agree. I mean, the more information we have, the better we can make a decision about whether or not we need to affect or adjust your blood pressure medication. You know, if you're angry, upset, you're in pain, your blood pressure is going to go high. Certainly that's artificially high. We wouldn't necessarily make adjustments based on that. So the more information we have, the better we can make a decision. But I would say on average 2 or 3 times a day. If we are adjusting the medication 2 or 3 times a day, if it's been stable for several months, you've been to your doctor and nothing has changed, probably once a week, unless you have symptoms. But check it any time. But I would say 2 or 3 times on average would be a good start.
Okay, I'm going to go off of script here, if you will.
Absolutely.
So many people right now walking around, sniffling, sneezing, their throat hurts, their ears hurt, they're coughing. Is it the flu? What can people do? Is there anything over the counter? Do they need to rush to the doctor? What's going on? Is it the weather?
It's a lot of questions.
I know, I'm sorry.
Yeah, I mean, this is cold and flu season, so we see it often enough. Certainly the flu, you're going to get some achiness, low-grade fever, dry cough, some nasal congestion. A lot of patients have allergy problems, which are chronic, and the weather temperature can exacerbate that, so you can have more symptoms at that time. Certainly, this is strep throat season as well, so that's more of a high fever, really sore throat, red feverish sore throat, can't swallow, can't talk. It's a really extreme situation, normally 1 to 3 days. So it could be one, it could be all. It's really up to the physician to examine the patient, talk to the patient, decide what they think is going on, and certainly prescribe medications. For most allergies and the cold and flu symptoms, there are a lot of over-the-counter products that can be tried very successfully. If you don't improve or if you have a lot of medical problems, probably a better idea to get to your doctor, because other chronic medical problems need to be monitored as well. Some patients have a simple allergy flare or a simple cold, but can exacerbate some chronic lung disease. It can exacerbate some heart failure. So a lot of times you need to get to your physician to make sure that everything is okay.
But it's not something you need to run to the emergency room for?
I don't think necessarily, no, especially if your symptoms are mild and you try some over-the-counter medication and you seem to be getting better or you're not getting worse. I think you can be observed at home, but certainly if you get a lot worse, just don't sit there. Please get somewhere to your physician's office, the emergency room, convenient care clinic, somewhere.
All right, we've got lots of other questions. I promise I'll get back on script. I'll ask your questions. Coming up next, we'll be back with more of your questions next on Live at 5. We're back with Dr. Mysonte Levine to answer your medical questions. This person says they had a pap smear for the first time. What are the risks and what should she expect?
Not really big time risk. I mean, depending on the what occurred during the pap smear, it should be a very, very low risk procedure. It's an in-office procedure. We're screening for cervical cancer. Probably bleeding maybe be the only risk. Certainly they use utensils, and the technique they use should not induce any other trauma. If there is, then maybe there was some issues with the technique used. So it should not be any problems with the pap smear.
Okay. This person asked, why is dementia associated with Parkinson's disease?
Because Parkinson's disease is a separate neurological disorder, basically a poor movement disorder because of lack of a certain chemical in the brain. A part of that spectrum of the disease, it can produce ultimately dementia. Parkinson's disease, like I say, normally starts out with a movement problem, tremor, falling, stiffness, increased risk of falls, and then as it progresses can produce dementia. It just has to do with the nature of the illness.
Another question, is alcoholism truly hereditary, and does it skip generations?
I personally feel like it is, just based on my experience dealing with patients. As you know, we're all stressed. Some patients do this, and some patients drink alcohol, and a lot of times it does run in families. Talking with the patients that suffer from alcoholism, they typically or commonly talk about their family or their father or their mother who abused alcohol. Certainly, I believe so, and a lot of times it's learned. As you know, we look at our parents to kind of teach us how to act when we're adults, and if that's something they did, we're more likely to do it. So I think it's learned, but it's also mainly genetic as well. That's my experience. That may be controversial.
Okay. What does it mean to have your esophagus wrapped?
A lot of times the esophagus, that's the feeding tube from your mouth to your stomach. It's in a very tight area down the middle part of your chest. There are a lot of other structures around it. So certain things can start to grow and impinge or wrap around the esophagus, whether it be a cancer, whether it be blood, whether it be scar tissue from maybe a previous surgery. That's the most I can deduce from that question.
Okay. My husband has a peptic ulcer caused by H. pylori. That was diagnosed on Christmas Day at St. Elizabeth Hospital. What could cause that, and will it go away?
The peptic ulcer a lot of times can be caused from the presence of the bacteria, the H. pylori. That's why they check it. We normally place patients on an antibiotic, what we call Prevpac, which they take for several weeks, and then the gastroenterologist can check for the absence or continued presence of the H. pylori and certainly retreat you, because studies have shown if you have an ulcer and you have the bacteria tends to be needed to be treated for the ulcer to be healed. If the bacteria remains, the ulcer more likely remains as well. So we want to treat that bacteria. That's one of the risk factors of peptic ulcer disease.
Okay. I think I may have depression, and I was wondering which question should I ask my doctor to get the help I need?
Basically, just let your physician know that you're feeling depressed. There are other physical symptoms related to that. Certainly if you're suicidal, and there's a lot of medications over the prescription-wise that we can recommend to a patient. So the bottom line is just to let the physician know. We don't always ask, and it's not necessarily something that we don't want to do. It's just that so many things during the visit. So a lot of times just let your physician know.
All right, Dr. Levine, unfortunately we are out of time, but we appreciate you stopping by. And as always, you can visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us at 892-7305, email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.